I'm Jonathan Flower, and I'm a researcher and cyclist at the University of the West of England, and it's good to join you at the Cycling and Society Annual Symposium. I'd like to start by acknowledging my co-authors on this presentation, Professor John Parkin, also at the University of the West of England here in Bristol, and Dr. Ian Walker, who until recently was at the University of Bath, but has just taken up a professorship at the University of Surrey. Now, from the day that we were told to stay at home, our lives changed. I'm sure my experiences were shared by countless others, and some will likely resonate with you. I've spent more than a year working from home, delivering teaching and conducting research remotely. And I didn't go any further than my legs would carry me, walking, running and cycling, until a few weeks ago, when that ended, when I was driven to a funeral in London once the restriction on numbers were eased. The past 20 months have been tragic at so many levels the whole world over. And yet, as people emerged from their homes last year and looked and experienced their local streets, it was for lots of people a wonderful time. And for the next 15 minutes, we're going to consider why. Now, my research explores people's responses to the changes they saw and experienced on their local streets during the pandemic. It was an extension to a wider investigation of relationships between behaviour, design and regulation in the street environment. Now, the data collection for this study was taking place when the COVID-19 pandemic occurred, largely between March and September last year, 2020. Now, by way of context, streets have evolved from being walking and cycling dominated, as you can see on the left of this chart, at the beginning of the 20th century, to car dominated today, as you can see at the right of the chart. And you can see on the top of the graph on the right hand side signs of a change since the year 2000. If we dig into the detailed data from some cities, such as London, it seems to confirm this. In London, public transport has become the dominant mode since 2003. And walking and cycling has grown in London to such an extent that it now has overtaken the private vehicle mode share in inner London since 2010. The COVID streets were, for some participants, including the participants in my study, the first time in their lifetime that they'd experienced streets that were no longer dominated by cars for more than, say, just a weekend or a bank holiday. And it's almost become like coming full circle to the pre-World War I streets you can see on this graph that were dominated by people walking and cycling. And to provide a bit more context, the Department for Transport data for 2021 shows that during the days in the first national lockdown, when general traffic was at its lowest, car use was down by 68% on average, and cycle use up 72%. Now, this graph shows the use of all motor vehicles, that's in the yellow line, cycling, the top line in the grey, bus outside London in red, and rail in blue. And if you look at the x-axis, you can see that stretches from the 1st of March 2020 to the 1st of June 2021. If you look at the y-axis, that's the percentage of use on the equivalent day in 2019. And you can see from this graph that cycling use is still raised towards the right-hand side there, and car use only began to return to pre-COVID levels at the end of the last lockdown earlier this year. And public transport levels are still down. In terms of my study, who was interviewed, well, there were 49 participants that I recruited from across Bristol. These were people from different groups, people who use buggies and prams, people who use mobility scooters and wheelchairs, parents and carers of competent child cyclists, visually impaired people, including cyclists on the back of tandems, older people, and younger people who walk locally. And they were all participants in a wider study, but due to the impact of COVID on everyone's lives, were additionally interviewed about their changing perspectives of streets during COVID. And they took part in a semi-structured interview between March and September 2020. Now, the participant responses were then organised by the overarching topics of the wider investigation, which were street design and the environment, regulation and policy, and street use behaviour. And then I carried out a SWOT analysis, strengths, weaknesses, opportunities, and strengths of analysis, which provided a way of showing the participants changed perspectives of streets due to COVID-19. The SWOT is principally used as a strategic planning tool, and here it was used as a way of translating the themes into a format useful for practitioners. Now, typically, the strengths and weaknesses are internal and the opportunities and threats are external. In this context, the strengths and weaknesses were things under the control of the city here being Bristol City, and the opportunities and threats are things beyond the city's control. Now, the next three slides provide summaries of the strengths, weaknesses, opportunities and threats for different parts of the study. So this one is for street design and environment. If you look at the left-hand column, you can see the themes that emerged in this category. They were creation of infrastructure, enhancement of the environment, and allowing greater diversity and being less busy. The middle column represents the strengths and opportunities for each of the themes, and the right-hand column is the weaknesses and threats by theme. Now, the circumstances reminded participants, the people in the study, of things that were already the case in streets, but the situation of COVID made those things particularly apparent. For example, streets not being fit for purpose, if the purpose is to walk, cycle and roll, or to stop, linger and play. Pavements in that context are clearly too narrow. Air pollution is bad for our health, especially if you have a lung condition like COVID. And the strengths, weaknesses, opportunities and threats analysis illustrates the time lapse in the interviews that took place starting in March and ended in September 2020. Early in the first lockdown, participants reported on the streets being quiet, with clean air and with vehicles removed. People then began to emerge and discover car-free streets, so there's a noticeable rise, according to the participants, in walking and running. Then they reported children beginning to play in the street and marking the carriageway with chalk games. Then new people start cycling, especially the young, as streets feel safe without the threat of cars. Local authorities begin to respond and repurpose carriageway space for lightly protected cycle lanes and wider footways on the high streets and bigger roads. And then other issues begin to emerge, such as a lack of public toilets, with cafes and bars closed and areas overcrowded with pedestrians to the extent that people cannot distance from one another. And then finally, as restrictions ease, the cars return and participants talk about the chalk games disappearing. The second SWOT summary is for street regulations and policy. Again, you can see the themes down the left emerging here were rules, policy change, and using public transport. And then participants got a glimpse of what might be possible if we choose to use our streets in non-car dominated ways. And then the third and final SWOT summary is for behaviour. And again, left-hand side, left-hand column, the themes emerging with tolerance and consideration, joy of walking and cycling, and social changes. And perhaps most surprisingly, there were many positive expressions from the participants of pure joy, with people describing the best of times. This was sometimes admittedly accompanied by acknowledgements of guilt or selfishness, given that this came at a time of physical and economic hardship and sorrow for many. I'd just like to read some of the participants' quotes. Participants said, "It was for lots of people a wonderful time. Cyclists were having the most wonderful time, and for us pedestrians, going out was absolutely magnificent. You had to experience it to believe it. There was an overwhelming feeling of how nice the streets are when they are empty. Lockdown was absolutely wonderful with no cars. I loved the coronavirus lockdown. It was wonderful for cycling and walking." And of course, not everyone's experience of lockdown was the same. And for a minority of the participants, it was the worst of times. Even for those that were positive, some of the initial enthusiasm turned to dismay as the motorised traffic began to return. Now, the study can report that the removal of motorised traffic on local streets led to a sudden radical shift in behaviour. Participants observed people using streets in ways they'd never done before, and there was a far greater diversity of people walking, cycling and rolling. Whole families were seen cycling in the carriageway, and parents were not afraid to allow 3-year-olds to cycle down the centre of the road, for example. The pandemic helped remove car domination of streets, and walking and cycling once again became dominant modes. Now, this graph comes from a paper from Gould et al., which was published earlier this year. And it supports the necessity of transforming streets and normalizing cycling before the full diversity of cities will be present on their streets. As you can see in this graph from their paper, cities and countries towards the top are ones where at least as many women cycle as men. So if you look at the y-axis, that's the proportion of cycle trips made by females. So if you find the 50, all the towns, cities and countries above that are ones with more, at least 50% of trips made by females. The x-axis at the bottom represents mode share of cycling. And you can see here that 7% mode share for cycling has been demonstrated as something of a tipping point. With so lower cycling rates, the working age population and men tend to be overrepresented, and women, children and over 60s are underrepresented. But places, as represented at the top of this diagram or this graph, with at least 7% cycling levels, have good representation of women, children and people of working age. Older adults too are reasonably represented. It seems that when streets are transformed, as was seen by the participants during and reported by them during the lockdown months, with walking and cycling normalised, then the full diversity of the population can take part. So to summarise, the pandemic was somewhat fortuitous for this research because many participants experienced what they described as their best experiences of streets during this period. Secondly, COVID restrictions have also offered policymakers, politicians, an unexpected opportunity to see how streets could be reconfigured to support more active travel and to tackle urban blight of air pollution and transport's contribution to climate change. The participants reported that for streets to permanently be places open and available to the diversity of people that exist, women and men, young and old, timid and brave, black, brown and white, active and sedentary, fast and slow, a transformation is required beyond just a few weeks, as was seen in the pandemic. Many people missing from streets are not obviously the ones marginalised by the street itself, like someone in a wheelchair when a drop curb is missing. But an environment and culture that's normalised streets as places where it is only conceivable to travel by car marginalise many. And only if that environment and culture changes can everyone perceive that walking and cycling are realistic options for some journeys. So during the pandemic, many streets were transformed and gave a glimpse to the participants what streets could be like. Many people who would never usually see their local streets as places where they could walk or cycle felt empowered to give it a go or to let their children try. So thank you. Thank you for your time.